have some questions for the panelists that have come up from the chat group. Is it normal? This is open to all the speakers, and Dr. Lydia, there was Prof Hoo as well. Is it normal that stroke patients can't sleep well at night?
Okay, I'll try to answer that, Tracy.
Okay, go for it.
It is normal for them to have their sleep disrupted after a stroke. So we have got to identify this issue because it will definitely hinder them in participating in rehabilitation the following day. So for example, if, if they can't sleep, the next morning, they will not be able to participate in their functional activities of daily living or their therapy. So what we need to do is we need to get them into a proper sleep hygiene. All right. So this is how it is.
Right. I think the second question. Anything you'd like to add, Professor Dr. Hoo?
No. Yeah, I tried the answer.
Okay. The second one I think it belongs to Dr. Hoo because you probably know this one better. Alteplase, is it available in all general hospitals?
Not really. Only those hospitals are ready to start this emergency service to treat stroke patients. So the listed hospital is in the My Stroke Hospital in the website. If the patient suffer from heart attack, usually they are using another type of medication to breathe out the clot. So we call tenetiplase, so which is another type of medicines. So nowadays, cardiologists or doctor hardly use this type of medicine for for heart attack or myocardial infarction.
Right. There's another question. I think this is also open to the panel. Can acupuncture be used to treat a stroke? Because I do know a lot of patients that come in for rehab are on acupuncture. Okay. What type of acupuncture is suitable to be used? Open to the panel.
I know a TCM, I think, Prof. Lydia.
Okay, so I'm not a TCM as well, but we do know the benefit of acupuncture in the sense that it is to promote well-being of a person. Okay, so for example, if the person takes acupuncture, the well-being is much better, much fitter, much stronger, much healthier. Hence, the disease that the patient has can be much better controlled. So this is some of the benefits of acupuncture. And the other thing is that if you look at the evidence base for acupuncture, there are already evidence to say that acupuncture do help if they have got some form of pain, any form of chronic pain. It does help because it does help to release some hormones, which is useful. Like endorphins, endogenous endorphins, which is useful for pain control. So, for example, if the patient has got a chronic neuropathic pain, acupuncture may be useful for them as well. That is my take on acupuncture.
Okay. Next one that we have, what services provided or the role of Alpro service for patient in post-stroke recovery journey? Eugene?
Okay, so the service that we provided for the post-stroke patient is that we have to consult or we have to assess on the patient first, because as we know, stroke patient, the complication or the condition is different from person to person. So I think assessment is very important. At Alpro, actually, we have do an assessment for the patient before we treat the patient. And after we already assess, right, then we will be given the treatment according to the condition. Most of the time, what we did is like what I already showed in the presentation, like mobility, okay, to improve the mobility and also try to reduce or avoid the second complication for the patient.
Okay. Next question that I have open to the panel. How fast can one patient recover from a mild stroke? I think we need to define mild stroke first. So maybe somebody is walking out of the hospital who can eat, who can walk, who can talk. So how long does it take for them to recover?
So if the patient suffer from what we call a temporary stroke, what we call a transient ischemic attack, so they may recover within minutes or hours. So what I like to share my experience that those patients that receive the emergency stroke treatment, they may recover within minutes as well. This is from our experience. If the patient arrive as soon as they suffer from stroke, so the earlier the better. Once we give the medication to break down the clot, we have been seeing a tremendous, very fast recovery. So as pertaining to the rehab recovery, I think I will pass the question to Prof Lydia to answer that.
Okay, so continuing with what Prof Fan Kee said, if they have got very mild stroke and they are in the window period of thrombolysis, their recovery is going to be quite good, and hence the rehabilitation may just be minimal. But if, let's say, you see a patient with mild stroke, it's just one of those lacuna stroke affecting just the motor power, they do not have more than one impairment, usually within a month, they should be able to get back on their feet. This kind of patient do not need inpatient kind of care. You can just do with early supported discharge.
Okay. I think this next one probably be for Prof Lydia and Eugene. What is the role of occupational therapy compared to physiotherapy?
Okay, Eugene, do you want to answer? You want me to answer first?
Okay, so maybe I answer first. So actually the occupational parts, from what I know, is that they will be doing more onto their functional part, right? Like maybe like open up the door, or maybe like dressing up for themselves. So it's more onto daily activities that they're going to do. But for physio part, is more onto like mobility and to avoid those complications, I would say.
Okay, I just add on that. So the core team for rehabilitation, the rehab physician we have mentioned, the neurologist we have mentioned, the occupational therapists, they look into the functional training of the person. They also do the cognitive therapy for the patient. They take them through to return to driving, return to work. The physiotherapists address the physical aspect of the patient, not just the modality. They take them also advanced, like return back to sports, return back to recreational, and the speech and language therapists will look into the communication and the swallowing aspect of the patient. So this serves as a core team for stroke rehabilitation because of the dimension of impairment that they have.
Right, we've got another 3 more questions to go. They're lining up. I think Associate Professor Hoo Fan Kee probably like this one. Is there any age range that can get stroke? I've seen babies. I've seen them at 89 to 92. So, Prof Ho, all yours.
I only treat 18 and above, so I only see the youngest 18. Yeah.
I've seen them young.
But again, the risk factor for less than 40 years old and more than 40 years old is different. So what we discussed today is majority more than 40, which is the most common stroke we encounter. Less than 40 belong to groups of what you call young stroke patient. Usually they have this inherited problem, like the blood is easily get clogged, or they have this young hypertension, which is due to the gene problem, due to kidney problem, hormone problem, etc., etc. So which is kind of very different kind of spectrum of patients. So what we discussed is the most common type of stroke, which is more than 90% of the stroke, or 95% or above, which is due to hypertension, diabetes, high cholesterol, smoking, and of course obesity. So those are the things that we can prevent. So those are the genetic problem, inherited problem, those kind of things we cannot prevent. So I think our focus should be something that we can do, we can prevent.
Okay, right. I think we've got 2 more questions to go. Mother has a stroke for 7 months. Is that possible to regain function back? Ooh, that's a tricky one. Not too sure what the level of disability is. Can we help?
Okay, so we mentioned about the golden period, the 6 months. This is basically where the improvement is the greatest. Following 6 months doesn't mean that there's no recovery at all, but it starts to plateau. All right, so depending on the severity of the stroke, what is the aim, what is the impairment, the person, the 7 month patient still deserve assessment, and we can still try to engage them in rehabilitation and do a specific goal according to their impairment. So you must not keep them at home.
Can I add on a little bit things?
Yep.
Okay, so there's always not too late to get a rehab or recovery from the stroke. It's just that the first 6 months, like what Prof Lydia said, this is the most active time that we can learn back all the things that we lost previously. But even that, if let's say after 1 year or 2 years time, you are still able to improve in your daily activities
Recovery.
and also the function and also the recovery. Yes. Mm-hmm.
Okay. I think we've got one more. If a person has been active pre-stroke, would it help for recovery to be faster? Does it make it recovery faster if they were active pre-stroke?
Okay, so based on my experience seeing patients, we have got a lot of patients with different pre-morbid functions. Definitely those with who is very active, they have got very good reserve pre-morbid. Number one, they can tolerate the rehabilitation better. We can start them on an active rehab program without much complication. Hence, their recovery would definitely be much faster.
Thank you so much. I'd like to add on behalf of NASAM that we also provide caregiver support and mentoring to stroke survivors at the National Stroke Association of Malaysia. I'll give you the contact details later, because this rounds out the holistic care for stroke survivors, that you're not just a movement, they're not just a person, the family also needs help. And sometimes if you got a strokey buddy to just buddy them along, it helps a lot. Okay? Right. So despite COVID-19 pandemic, stroke rehabilitation has to be ongoing, as it is essential to prevent long-term disability. At NASAM, we have kicked a free rehab program for stroke survivors for the B40 community. This is a year-long program sponsored by Yayasan Hasana. Viewers who are interested can call our helpline at 018-222-1878. Today, we've heard about regaining life after stroke. To what extent can life be regained? Let me share with you this video. At NASAM, we continue to empower stroke survivors so that they can return to the community as champions. And yes, some of those stroke survivors are running faster than my own therapists. So yes, they can get a lot of their function back. We give them hope. We give them a second chance at life. Dear viewers, we appeal to you for help. Please go to www.nasam.org. Please donate. It's not how big or how small. Every ringgit will help us keep moving forward. I'd like to thank all our speakers and our panelists, Professor Dr. Hoo Fan Kee, Dr. Lydia Latif, Eugene, physiotherapist at ALPRO, for being with us today and to share their knowledge with us on how to help raise the awareness of stroke in this country and how to help people who have had a stroke and how to get back their lives. Before we close, I'd like to remind you that stroke is a medical emergency. go to a hospital fast as soon as possible. Thank you and goodbye.